Okay, myths about Alzheimer's. Things that, yes?
Has there been a definitive study to determine what is appropriate sleep? Because I've read literature that says, oh, you must have at least 8-9 hours sleep, and then I've read that 6 is more than enough. So where's the answer? Something
There's no definitive study because different people need different amounts, but the recommended range is 7 to 8 hours. 7 to 8 hours of uninterrupted sleep. So waking up in the middle of the night to urinate multiple times takes away from that 7 to 8 hours of sleep. You really need 7 to 8 hours sleep. You need what's called rapid eye movements to get going. You need to hit certain stages of the sleep. You need to have good circadian rhythm. One of the reasons why melatonin is used sometimes as a sleep aid is that melatonin is something that's naturally secreted during the circadian rhythm, which is the life cycle of the day for the person. And introducing melatonin, again, not abusing it and taking it every day is helpful. Yes?
Take a nap during the day, you know.
Naps during the day make you feel better. There's some people who say, you know, they're restful, but I find that people who take naps during the day tend to have more trouble sleeping at night. So better to get the 7 hours of uninterrupted sleep than get 6 hours with an hour or 2 hour nap during the day. Okay? All right, myths about Alzheimer's. Memory loss is a natural part of aging. Wrong, not. It's a myth, okay? Memory loss is a sign of a problem, not because we get older. A second myth. Alzheimer's disease is not fatal. Unfortunately, that's also a myth. Alzheimer's does kill you, unfortunately, because it's a progressive disease that's shrinking your brain and stopping your brain from functioning normally, and eventually, your brain doesn't function, you don't function, and you succumb. Third myth, only older people get Alzheimer's. Again, not true, okay? This childhood obesity epidemic, folks, you will see, you're going to start hearing more and more reports of people developing Alzheimer's at considerably younger ages than we're all used to. The numbers are going to shift in the wrong direction, unfortunately. Myth number 3, drinking out of aluminum cans or cooking in aluminum pots and pans can lead to Alzheimer's. Not true. No science to support that. 5, aspartame, that's NutraSweet, the artificial sweeteners. Now, don't take this to mean that you should be using artificial sweeteners. They are incredibly unhealthy, okay? There's all kind of other chemical problems related to them, but one of the problems is not memory loss. Flu shots increase risk of Alzheimer's disease. Not true, okay? Silver dental fillings, most dentists don't use the silver fillings anymore, but they do not increase the risk of Alzheimer's disease. Again, myth. Finally, there are treatments available to stop the progression of Alzheimer's disease. Not true. There are no treatments. There are no well-tested treatments. We'll talk a little bit later about one thing that seems to have great promise, but there are no known real treatments for Alzheimer's disease, unfortunately.
Why do you say that?
What's that?
Why they tell you that they can put you on medicine that can slow it down?
But they can't treat it. They can try to help you with there's things that you can do, and we'll talk about things that you can do to help yourself or help the person who has it, but you're not really slowing the progression of disease, you're just helping with symptoms. Okay, one of the other big myths is about statins. Do statins help in Alzheimer's? Okay, what do you think?
They decrease blood.
No reliable evidence of statins. But those of you who read the news yesterday know that in the Women's Health Initiative, one of the largest studies ever of women's health revealed statins increase the risk of diabetes over 40%. Now, folks, you may remember that we've been having a conversation now over the last few weeks about statins. How many of you are on statins? How many of you have your doctor ever discussed getting you off a statin? 3 hands, okay? There's a craziness in this country that once you're on a statin for life. Well, every doctor that has a patient on a statin now has to take this new data into consideration and weigh the risk-benefit analysis of keeping you on a statin. There are 8 best currently known ways to prevent Alzheimer's disease. These are not definitive. These are the generally believed beneficial ways of trying to decrease Alzheimer's disease. Some of these are going to be familiar to you from the longevity lecture, okay? Because we know Alzheimer's kills. People who live longer, obviously, are not being killed by Alzheimer's. So, they include, but before we get that, here's a cute little comic. A new study says drinking prevents Alzheimer's. So the guy says, get me a beer, whoever you are. Okay? So there's some belief that drinking may help, but I don't put overly too much faith because, again, it may help with Alzheimer's, but it may cause other problems. So let's get to the actual ones. Remember this cute little guy, the get moving guy, laying on your back like that, maybe when you're 1 year old, looks cute, but at your age, ladies and gentlemen, if you're over the age of 2, you need to get up and you need to move and you need to get going. Smoking, bad for everything, okay? Nothing good related to smoking, nothing. Eat more bananas. Oh, why? What does potassium do? Lowers blood pressure. Bananas are meant to lower blood pressure. And so, I mean, look, we're not talking about you can take a banana instead of your blood pressure medication, or kiwis, which are also green kiwis, yellow kiwis, better than the green ones, known to lower blood pressure. I'm not recommending you start eating kiwis and bananas instead of blood pressure medication, because we saw there's a very strong correlation between blood pressure and dementia, and so you need to make sure. Now, what is elevated blood pressure? Anything above 120/80 is elevated.
And if you have low blood pressure?
That's a different story. You probably have benefits from the low blood pressure. But 120/80. Now the problem is you go to a doctor and you're 125/85. Doctor says, compared to my patients who are 150/130, that's not a big deal. But the reality is you are now officially hypertensive at 125/85. And so you need to make sure your blood pressure stays below 120/80. Truly important, yes.
I thought they lowered that range.
Below 120, well, what they're basically saying, stay below 120/80 because 120/80 is the bottom level of abnormal, no longer considered normal, yes.
For years it was 140/90. When did that change?
I can't tell you when it changed, but I'll give you an anecdote about medicine. When I was in my surgical residency in the 1980s, it was, don't give transfusions because, I think I told you this, there might be hepatitis B in the blood. And then by 1982, it was don't give transfusions because there might be AIDS in the blood. And by the late 1980s, it was don't give transfusions because there might be hepatitis non-A, non-B. And that then became hepatitis C. And since then, and at that point, quite frankly, I said to myself, if I can avoid a transfusion, I will avoid it to my dying day because who knows what else is in that blood? And it turns out there was hepatitis D and E and F. So they're constantly finding new stuff in the blood. And that's why one of the things recommended is to pre-donate your blood so you have it in case you ever need blood. Yes?
Is salt always a problem with blood pressure? Or they
No,
don't?
no. In fact, there have been a number of studies lately that are suggesting that people who completely cut salt out are increasing their risk for cardiovascular events. So my advice in regards to salt, unless you know for sure that you have a problem with blood pressure that is sensitive to salt, my advice is don't add salt, but don't avoid foods with salt.
How do you know?
Get a blood pressure cuff and see if I ate a food with salt, did my blood pressure go up? And if my blood pressure didn't go up, you're not one of those people that is affected by salt.
How soon after you eat?
It could be an hour after, it can be a few hours after, it can be the next day. I mean, you're just basically seeing, are you having a physiological effect? Now, let me give a caution here. I am not giving you medical advice. It is not appropriate. I need to know you personally before I can give you individual medical advice. Yes?
Why is it necessary or is it suggested to keep the statins, keep the numbers low, as low as possible?
So again, this is one of the things that's like diabetes, and it's been going on since I was in medical school. How low do you have to keep blood sugar? And that's the same debate that's now raging in terms of how low do you have to keep cholesterol, and how high do you have to get the high-density lipoproteins, and how low do you have to get the low-density lipoproteins. And I believe the final chapter hasn't been written yet, okay? Has not been written yet. But we seem to know in general that statins, while they have some very negative side effects, have reduced the incidence of cardiovascular events, okay? Doctors will tell you anecdotally that less patients are getting stented, less patients are getting procedures for clogged arteries since the introductions of statins. So I don't want to tell you that statins are bad, because that would be a false statement. Statins clearly play a role for some people, but like everything, you need to balance it out to what else is going on in the person's life. And I personally believe that if you can do anything to lower your cholesterol other than taking a drug, that should always, 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 always be your first choice. Naturally, improving your health is always better than popping a pill. I know we're a pill-happy society, okay? But pills should be the secondary. Yes?
Question is, when you talk about high blood pressure and hypertension, don't they have like a chart, like when you're a certain age, like say you're 80 years old, then however, different, the numbers are different than if you say 50 years old. You said that if you go over 120 over something, that means the hypertension, that you're in a risk factor. It's like if you're 80, if you say 80 years old.
Right. I don't like those charts, and I'll tell you why. They're averages. And you know what? You and you and you're not an average. You're a person, okay? And the doctor has to evaluate whether or not you're healthy or you're not healthy. And blood pressure is one biometric. It is but one measurement of your health. Nobody in their right mind, no doctor in their right mind, would reach a diagnosis on one finding and one finding alone. So a doctor is supposed to take the combination of a history and a physical exam and blood tests and any other diagnostic procedure that may be appropriate, and then use the body of evidence to arrive at a diagnosis. And even then, it's not guaranteed to be right. One of the first things they teach us in medical school, when you hear hoofbeats, think of horses, not zebras. What does that mean? It means first think of the most common thing that something could be responsible for, and then think of the more esoteric. So again, there are basic biometrics: blood pressure, glucose, cholesterol, body fat composition, your weight. Now, BMI, for example, is a big debate. Medicare says you can get this weight loss program if your BMI is 30. I got news for you. Really muscular people who do not have an ounce of body fat could have a BMI of 30, okay, and lift this entire row up. So BMI, again, is just one factor, and then body fat composition is another factor. Good medicine is about taking the body of evidence and trying to make good judgments.